Okay, our insurance expert Craig Gusson has just returned from Washington, D.C. for some extensive talks with lawmakers there. Slide on in here, Craig, and let's talk about it.
Okay.
What did you learn while you were there that surprised you about Obamacare and the latest healthcare news?
Probably the biggest surprise is that we can't get anything done there. That was one of the things I heard.
You thought you were going to be able to go there and get some answers and move forward.
Congress is pretty much in a stalemate until the elections. The one good news is, right now it's 30 hours, you get health insurance, and everybody's dropping their hours down to 29 so they don't have to pay it. They're probably going to pass that where it's going to be 40 hours. Now that's a big deal because you're looking at about 10 hours a week, which is about 40 hours a month that a person's going to gain. So you're looking at someone gaining, maybe $5,000–$10,000 more in income.
Well, let me make sure I understand this then. If you worked 30 hours or more, your employer was required to provide insurance, so they were cutting your hours back.
To 29.
So now you don't have insurance and you have fewer hours.
Exactly.
So by raising the limit back up to 40 hours, even though they wouldn't be required necessarily to provide you health care, at least you're getting more hours and getting paid more.
Exactly.
And it's not costing you hours. Okay.
Exactly. And that's a big deal because I think, the last thing you want to do is, have to pay for your health insurance and also, lose all this money. So that's a really big deal, and that's one of the things that we picked up. That
now, will Congress do this through legal channels, or is the president going to do this through another executive order that people are still debating whether or not that's even legal for the president to change law?
From what the congressman's office told me was that they have votes on both sides of the aisle. So
okay, so this wouldn't be something that would be contested down the road. Congress would get together on this.
It's going to wait.
Now, let me ask you about this number that's being floated right now.
Okay.
It was 7 million that they had to have signed up by the end of March.
Right.
That came from the Congressional Budget Office, not the administration originally, but the independent Congressional Budget Office says for this thing to work, you have to sign up 7 million people. Well, now the administration is saying, well, we don't know where that number came from. I'm telling you where it came from. The Congressional Budget Office. Now the administration is saying, well, we've got 4 million signed up. Do they?
We think, based on the numbers I look at from my clients, of the 4 million, I'll bet you maybe 75% of those, which is 3 million, have paid for their insurance.
So the number is more like 3 million.
3 million. Of that 3 million, probably at least 1 million are people on Medicaid, which means they're not paying for anything.
So they should not be counted in that 7 million that they're counting on in order to be able to fully fund Obamacare. So that is deceptive in order to put that number out there.
One of our speakers when I was in Washington, D.C. showed the numbers from Connecticut. Over 50% of the people signing up for health insurance in Connecticut were on Medicaid and getting it for free. So when you look at those numbers, now, so we have 4 million down to 3 who've actually paid for it. Then you take away the million who's on Medicaid, that's 2. And of those, how many people are going to look at the bill during the year and go, they're starting to get buyer's remorse and they say, I really can't afford this, or I don't want it, or they lose the subsidy because they're making more money. So we're probably looking at the end of the day with Medicaid, probably maybe somewhere around 2.5 million people will actually have health insurance.
Can this thing work at this point? I mean, you're the insurance expert. And this is not a political question.
No, it isn't.
It's just, and it never has been when you and I have been talking. But when one side's giving certain information and the other side's giving other information, if it looks like people aren't being honest, we've got to call them on it.
That's exactly it. And the concern I have is what people don't get is 2 things. The people who are getting subsidies that put down wrong numbers, they're going to have a major tax problem next year. And they don't see it.
So they're putting down, you're saying that some people are putting down false numbers and that's giving them a subsidy. But we've heard that these phone screeners are encouraging them to do that.
I don't know that from my end, but I do know in California, 80% of all the business that covered California got was from agents. So we've really done a good job of doing that. But going back to your question about is this going to work, I look at and I go, how many people had health insurance December 31st that may not have it in 2014? And I think when you get all done, I don't see a big difference between last year and this year except the Medicaid numbers. And if those Medicaid numbers keep growing, which they are going to be based on what Massachusetts showed us when they went to this, I think that financially we're going to be in a big heap of trouble. And I think that's a concern I have. And will it work in the long run? No, because we don't have the money to pay for it.
All right, before I let you go, and again, we're flat out of time, is there anything else from Washington quickly that you can pass on to us from your time? And we'll share more later on.
What we talked about was mostly the how to lower the cost. And we talked about there's a HIT tax, a health insurance tax that's going to come out to about $500 a family. And we talked about delaying that for a couple of years. We talked about right now in 2014, if I was 20-something and you were 60-something, the most they could charge you was 5 times what they charged me. And this year it's 3 times what they charged me. Well, the problem was it's affecting the younger people, anybody under 45, because the rates are going up higher to subsidize the older people.
Okay.
So those are the kind of things that we're trying to get them to change, because the concept sounded good until they realized reality, it doesn't work.
Okay. Insurance expert Craig Gusson, again, just back from Washington. Yep. We'll share more about your trip on our next visit.
And you can blame me for the weather, because I left snow to come to rain.
To come back here. Okay. Well, we're glad you're home.